Welcome, everyone. This is Leanne Jones from the Society of Thoracic Surgeons. We are here for our Congenital Heart Surgery Database monthly webinar. Today is Wednesday. Is today Wednesday? Yes, Wednesday. No, Tuesday, February the 16th, 2021. Oh, my goodness. All right. Welcome, everyone. Just on the call with me today from the STS, we have myself, Carol Crone. I think that's it from the STS team today. From IQVIA, we have Melanie, Joe, Rhonda, Jean, and then from our core group and surgeon leadership, we have Chastity, Janet, and Dr. Jacobs. So thank you, everyone, for joining me today. Per usual, I'll just provide a quick STS update, and we'll turn things over to IQVIA for their updates, and then we'll finish off with our user feedback. Please be sure to put your questions in the Q&A. Also, we do have the raise hand function enabled, so if you prefer to speak or have anything you'd like to comment on, please be sure to utilize that raise hand function. Also, again, it is very helpful to put your question in the FAQ in the Q&A so we can keep track of those questions. Also, if you do utilize the raise hand function, just please be sure that your microphone is enabled. So, let's see here. All right, for our STS updates, this looks familiar. The same things that we covered on our last call. Just wanted to reemphasize. The 2021 harvest schedule is posted, and per our last call, everyone should be aware that the 2021 harvest close date is to be determined. So it was originally set for, I believe, March the 12th, but again, that harvest close date has been pushed back. Obviously, it's to be determined. We do not have an actual close date. Please know that you all will be given a minimum of 2 weeks notice prior to the harvest close date. Again, we encourage you to continue to use the open submission and cleaning your data. Please take full advantage of the open submission, and please continue again to submit and clean your data as typical, as you normally would. And again, just a reminder, the spring 2021 harvest includes procedures or dates up through 12/31/2020. For the primary procedure mismatch report, again, just a quick review of that. Again, the overview is posted in the resource section in our IQVIA library. Primary procedure assignment, again, I just wanted to reemphasize this from our last call. Primary procedure assignment occurs in analysis at DCRI. So IQVIA does not change your data. So again, just to reiterate, the primary procedure assignment occurs in analysis at DCRI. IQVIA, via the primary procedure mismatch report, they will let you know if what you have currently assigned in your data assigned as primary procedure will not match or does not match what will be assigned at DCRI when the data is moved over to analysis. So if there are any additional questions on that, please feel free to ask away. If you would like to speak offline, I'm happy to have a conversation offline and just explain the process a little bit more if needed. So please feel free to reach out to me directly. Also, congenital public reporting, as we stated on the last call, no public reporting of the 2020 data. A new working group is being convened to plan the future of congenital public reporting. There's a lot of work going on, a lot of work that still needs to be worked out and decisions to be made. So more information about the future of congenital public reporting will be coming soon. Also, just a reminder that the STS does have a mentorship program, and we do pair experienced data managers with our new data managers. For more information about our mentorship program, please reach out to Addie Dolan. She can be reached at adolan@sts.org. We do need both mentors and mentees for this program to be successful. So please, if you're a seasoned data manager and you would be willing, so please fill out a form to become a mentor to some of our new mentees. So we do appreciate it, and this is an invaluable resource for our mentees. So again, please consider signing up for our mentor and mentee program. And again, I did put a link in the slide here for the form to fill out to become a mentor or to become a mentee. As you all know, STS had our 2021 annual meeting the end of January. I just wanted to highlight a couple of lectures from the annual meeting. The Thomas B. Ferguson lecture covered personal reflections from COVID-19, as well as the Vivian T. Thomas lecture. That lecture was about the long shadow of racism and racial bias and the lack of diversity. Highly recommend, if you have the time, when you get the time, to please check out these two lectures, as well as the other lectures that are available. These lectures can be accessed through the STS website. Again, this is access for everyone. You do not have to, sign up or pay or get access to these lectures. If you go out on the STS website, from the blue bar up at the top, if you just click on this publications button here, and then from this pop down box here, just click on podcast episodes, and then this will bring you to the list of our a link to both of these lectures, as well as other lectures that we're giving at the STS annual meeting. Again, I'm actually going to go back and listen to these again. They are absolutely phenomenal lectures that were given at the annual meeting, and I highly encourage you to go out and take some time to listen to them. Another thing that I wanted to point out, in case any of my data managers were not aware, the STS does have a patient website. Again, I've put the link out here to our STS patient website. Again, the patient website does offer immediate and easy access to expert multimedia content on cardiothoracic diseases and operations. If you do work directly with patients at your institution, I encourage you to check out the STS patient website, refer your patients to the STS website. Here, for example, for congenital, we have a page dedicated to VSD. Again, we do have downloadable resources, handouts that you can give to your patients. Excuse me. And again, this is just a screenshot from our STS patient website that you could share with patients on what to expect on your day of your child's or your day of congenital heart surgery. Again, we do encourage you to check out the STS patient website. If you have any questions about the patient website, please feel free to reach out to Jennifer Bagley. She is our patient website staff person that's in charge of all this information. If you have any questions, any comments, suggestions, again, just please reach out to Jennifer, and she would be happy to speak with you about the STS patient website. That is all that I have for our STS updates. Just gonna turn things over to Joe with IQVIA.
Great, thanks so much. Good afternoon, everyone. Just a few things to go over today. Number one, the update that went through this past weekend on February 13th, STS 5555. We updated some validations from error to critical error status, just to ensure that bad data is not getting into the registry at all. And so on the next couple slides, we have a list of those specific data elements that have been updated. So these used to be standard errors, and now they will be critical errors if they're encountered, giving you an opportunity to resolve them before the data gets into the database to help ensure that these inconsistencies don't find their way into the data set. So these are all more or less just logical inconsistencies. Mortality date can't be greater than today's date, for instance, unless you're predicting the future. So there is a full list of this. If you go under notifications in the database, there is a posting for February 14th that will list out all of these for you so that you can access this list of updates at any time. And if you do encounter any of these critical errors when you're not expecting to, feel free to reach out to the support team and we can look into your DAT files and see what's going on.
Joe, can I ask a question? This is Janet, or is it not the right time?
Go for it.
I'm just concerned about the mort date cannot be less than discharge date, because we have patients that sometimes that doesn't exactly work out with our ADT.
Melanie,
or has that been considered?
A comment?
Sorry.
I can take
Carol,
that.
yes.
This is Carol. I can take that one. I believe that the mortality, if the patient dies, that it's supposed to match the same date, even if the patient's discharged after the date at which they die. It should be the date of death that's listed as the discharge date. But is that not how it's been done, Janet?
There's some gray in it, so I was just clarifying in case people get critical errors that might pop up.
Yeah, I think the training, I think it's clear. I think we have it in the training manual, but let me pull it up real quick to double check, because that's a good point. We have that same thing in the other databases too, where the patient might expire one day, but is held over in the room for for visitation and things like that, that falls into another day. So their discharge in ADT is actually different. Let me see what we have. Hold on, I'm pulling it up on my.
Okay.
Maybe I'm pulling it up.
Carol, do you want us to come back to this and then we'll just move on? And then
Yeah, go ahead. Actually,
Oh.
Yeah, I don't see any clarification in there on sequence. I think that sequence 490 for mortality date, MTDAT date. So we should provide some clarification in the training manual on that.
Okay.
Leanne.
Got it. Thank you. Thanks, Janet.
Janet, is that helpful?
I think it just needs to be clarified so that we're being consistent and people's data isn't not accepted because the patient stayed over midnight and their discharge date
No
doesn't
problem.
match. So it's just something that we need to think about. It doesn't matter how it's resolved as long as it's clear.
Sure, absolutely. And we'll bring it to the core group before it goes into the training manual to make sure we're all on the same page. Thanks.
Thank you.
Sorry,
right.
Joe.
No, that's fine. It's important distinction. All right, looking into the future in a couple weeks on February 27th, we have a couple updates targeted for an upcoming release, starting with for the missing variable report, STS 5474. There is an issue where the missing variable report is showing the prothrombin complex concentrate 3 dose 3 variable as missing on the report, even though the field is not available for entry on the case form at all. So we are looking to get that resolved in a couple weeks. And then on the dashboard report, the participant dashboard, STS 5484, the STAT4 filter is excluding cases assigned to LV endocardial fibro, oh dear, sequence number 3390, and double root translocation sequence 3400. So we are looking to get that fixed for you as well. And those were my updates for today. Melanie does have a couple of more items to go over with you, but for my portion, just as usual, if we didn't discuss anything you've reported and you want more information or updates on those issues, feel free to reach out to our support team. And we are also looking into other items that you've reported for updates further out into the future. And with that, I will turn things over to Melanie.
Thanks, Joe. And you
Welcome.
took the hardest part with that item there. Hello, everyone. So just a quick update related to primary procedure and to let you all know the status of where we are with that. It is targeted to be released the weekend of February the 27th, and we do have a couple of enhancements that will be going in related to that report. So just wanted to do a quick review of what's coming. We touched on it last week, but just wanted to make sure that we can cover these again. And just, of course, if there's individuals that may not have been with us last week, that they are also on the same page. So the first item is 4386. This is related to updating the report logic to include consideration for combination codes for primary procedure. Right now, the logic is not considering the combo codes, so that will be updated. Next item is 4371, where we will be adding the Kawashima procedure to the exception 1 code list for consideration. Right now, Kawashima is not on that list. So there have been instances in which it has been listed as not being selected as the primary procedure. The next item is 4387. We are updating also related to the Kawashima to make sure that the primary, when the Kawashima is coded, to make sure that it is displaying as the primary when done in conjunction with a Glenn or Hemifontin procedure. We just want to make sure that, of course, that it's never downgraded. So that logic will be coming in that enhancement. Next slide. And continuing on that, we have two more enhancements. 4389 is updating the report logic to include a specific rule for the 3 identified VSD repairs when selected in combination with a PFO. So that logic will be updated, and that's the PFO primary closure procedure. And then we have 4388, where we are updating the exception rule 1 list to include the 3 hybrid approach codes that you see listed here. Currently, those are not listed in the code list, the exception rule code list. And so that will be updated to include these 3. And then the very last item that we have related to the primary procedure report was an identified defect, which is 5471, where the report is showing a mismatch between the TOF repair, which is code 350, and the RVOT procedure, which is 510. Currently, right now, the report is reporting that the RVOT should be primary, and that is incorrect. So we do have a fix, and we'll be implementing that on the 27th also. I believe that should be the last of them. Let's just double check, Leanne. Yep, we would be going into the IQVIA support plan. So that's all of the updates related to primary procedure. And again, that is targeted for the 27th.
Great, thank you so much, Melanie. I know I've gotten a few questions about that date, so it's good to have that date finalized. So I appreciate all you guys' hard work on that. Again, these ending slides you all are very familiar with, just our support plan. Again, just the usual plea to please include your participant ID number in your communications with STS and IQVIA. A list of resources that are available to you. Here's my contact information. If you have, please, if you all have any questions, concerns, please reach out to me directly so we can talk about your questions and concerns. I can take your specific questions and concerns back to Carol, Donna, the surgeon leaders, the team. Again, please reach out to me directly with all of your questions, comments, concerns, the good, the bad, the ugly. That's what I'm here for. Again, just please urge and encourage you to reach out to me directly, and so we can have our, the one-on-one conversations and work directly with you to address all of your concerns and your feedback. And again, I can take that information back to Donna, to Carol, the team, the surgeons, to IQVIA. Again, that's what I'm here for. So please take advantage of that, of this opportunity to reach out to me directly. For, again, database operational questions, again, just reach out to STSDB at sts.org for any types of invoicing questions, contact update questions, access to IQVIA questions. Just again, please reach out to us at STSDB at sts.org. Mark your calendars accordingly for our upcoming CHSD webinars. Our next user group call is scheduled for February 23rd at 12 p.m. Central. Then we have another user group call on March the 9th at 12 p.m. Central. And then our next monthly webinar for March is scheduled for March 16th at 12 p.m. Central. So again, please be sure to mark your calendars. STS will, of course, send out a reminder of these webinars. But again, we do know some institutions have issues receiving our STS emails from marketing. So again, please mark your calendars for the 23rd, the 9th, and the 16th of March. So let's see here. That's all that I have in terms of STS updates and IQVIA updates. So we're going to turn things over to you all for your questions and concerns. Again, the raise hand function is enabled. So again, please feel free to raise your hand if you would like to talk or need to clarify any of your questions that are in the Q&A. So with that, I'm going to go ahead and we'll start tackling some questions. All right, let's see here. Our first question from Diane. Okay, one of the February, this looks more of a surgeon and core group question. Let's see here. One of the February 2021 updates on the FAQ questions was, would a patient that comes in and is on CPAP at night, as he is at home, be considered a pre-op factor for non-invasive therapy? Sleep apnea, not respiratory failure, but a condition. The answer was yes, code non-invasive support as a pre-op factor. Can you explain this more to me? I've been interpreting the definition differently. Definition for 600, non-invasive respiratory support to treat cardiorespiratory failure. The time frame of any time during the hospitalization should be applied. If patient uses MPAP and is admitted from home the day of surgery and does not have their sleep apnea equipment on prior to the surgery, how is this coded? What is the time frame on this non-invasive support? I thought it was that they had to have it on when they went into the OR. Does it include any time during a long pre-op hospital NICU stay?
Hey, Leanne, this is Chastity. Do you want me to
Sure. Anyone?
try to?
Chastity, Dr. Jacobs, Janet. Yep. What do you
Oh,
guys?
sorry, I didn't know everybody was on. I think our thought when answering the question was if the child requires some type of non-invasive support, at his baseline, that then, just like if you were home with a trach and event and you required mechanical ventilation at baseline, I don't think we looked at it from the fact that they have sleep apnea, but I think the sleep apnea causes the patient to have respiratory failure, which is why he's on his non-invasive support at night. We've not addressed the issue yet of the hospitalization being if you were in an outside NICU and then transferred, what happens with those pre-op factors. I think that's going to be addressed in the next upgrade. But I guess I would follow the same logic of this child at baseline requires that level of support. So just like if the patient were to transfer from a NICU and have invasive mechanical ventilatory support, i.e. they're intubated or a trach on a vent, we would code that factor.
Right, but I think the key here is that it has to be coded if it's present when they're going into the OR. If a child was on a mechanical ventilator 5 days before surgery and then extubated, and then went to the surgery extubated, they wouldn't have preoperative mechanical ventilatory support.
No, the definition is
Yeah, they would.
the hospitalization.
Yeah, it's anytime during the hospitalization. So when we talked about the adult CPAP patients, we decided that if the patient was in the hospital overnight.
No, I meant if it was 5 days, if they were on either non-invasive ventilatory support or invasive ventilatory support, and prior to the hospitalization. That's what I was trying to say. I didn't say it right. So if you were either ventilated or not ventilated, but on non-invasive support, and then you got extubated and you were off that, and then you came into the hospital off that, then it would not count. So
Right.
if this child was on CPAP at home, but came into the hospital not on CPAP, then it wouldn't count. If this child was on CPAP at home and came into the hospital on CPAP, then it would count. That's what I was trying to say. I didn't say it very well the first time.
Got it. What if
We
their
agree with that
CPAP is
version.
yes. What if CPAP is at night only? So obviously it's noon, they're coming into the hospital. They're not on it currently, but they were on it last night and came
They
off
didn't
at
come in.
6
This has to, right now the rules are what you received while you were in the hospital.
Okay.
Okay. Thank you, guys.
That's the cutoff right now is if the kid's on it in the hospital, then it counts. If the kid was on it at home but not in the hospital, then it doesn't count. As of now.
All right, and I'm making a note for the specifics so we can clarify. Okay, great. Thank you, Chastity, Janet, Dr. Jacobs. Diane, I hope that answered your question. If not, just let us know if you have other questions. Okay, our next question from Heidi, generic IQVIA question. Asked some time back and considered as enhancement. When will basic uploader access be available? Having the ability to have staff upload their DAT files and generate reports without access to the dashboards and national reports is helpful for programs that has multiple staff members. Any update on this? Not all staff needs access to the dashboard's national reporting data.
Hi, Leanne. It's Melanie with IQVIA.
Mhm.
Hi, Heidi. We do have this on the list, but this again has to be approved by STS. So we will follow back up. And I believe, trying to make sure that we have your contact information. We'll follow back up in regards to the update in regards to this request.
Yep. Thank you. And I think Jane has this on her list as well. So for us to talk about on our elaboration calls.
Yep.
Okay. All right, thanks, Heidi. So from Patricia, can anyone tell me if there is an STS vendor for congenital where the past diagnoses and past procedures carry over to the next surgery?
As in you don't have to re-enter it again, like when they come back in for another surgery?
I assume that's what she means.
Or for non-index surgeries during the same stay, I think, but it's this, I don't know of a software that does that.
Mm-mm.
Well, does Cardio Access not do it?
The things that are not user added go forward, but the things that are user added do not go forward. So I was reading the question a little bit differently. Let me
Oh, I
reread
see.
it.
Okay. But you don't have, in Cardio Access, we do not have to re-enter something we entered on a previous surgery because it's there.
If other things are done at outside facilities,
Mhm.
it doesn't go from one surgery to the next surgery. Like you say someone had their Norwood someplace else and you enter it in their Glen, you have to enter it in their Fontaine. It doesn't keep coming in the status post section. The status post only pulls from the procedures that were done at your institution.
Got it.
Thank you, Janet Chastity. Okay, from Aaron, for the new updates for IQVIA, from IQVIA, we would have to resubmit our data to see the new critical errors. Is that correct, Melanie?
Yes, that would be correct. So if you were to, this is those new updates, if you resubmit and you encounter any of those inconsistencies, that's when you would see those actual new validations appear.
Got it. And also in regards to these new updates, if the field is left blank, is that logic factored into these new algorithms?
If the field is left blank, it's going to allow the information to come in depending on parent-child relationship also. But those blank fields would then appear on the missing variable report.
Right. Got it. All right. This is for support. So Jean, I think this one may be for you. Is there?
Hey, Leanne.
Yes, ma'am.
Hey, Leanne, sorry to interrupt. This is Carol. Can we go back to that last question with the fields left blank?
Yes, ma'am.
Because I think we'll need to revisit. I think we might need to revisit that internally because historically what happened at DCRI is if that field was left blank, the record would be rejected from analysis.
Mm-hmm.
So if they don't provide an OR date, but they provide a discharge date, DCRI wouldn't let that record in because we need all of those fields. So maybe we need to take that back, Melanie, to make sure we're on the same page with how that's being handled for the critical errors with the missing fields.
Yes, definitely. Let's do
still
that.
gonna-
And I think, and
Yeah.
again, I think I didn't, when responding to that, I was thinking about the general, just.
Oh yeah, the general ones we don't care.
Yeah, general submission. So if it's inconsistent, meaning that there's one field that's blank and then the other is entered, in that regard, it would trigger a critical error, but I'll go ahead and I'll just recheck that.
Okay, thanks. Yeah, just because I think the other ones are okay. They'll just go into the missing variable report.
Right.
Mm-hmm.
But when we're verifying logic of the data that's abstracted,
Right.
those are the ones we just need to make sure we have data on. Otherwise, it's not helpful to go into analysis without a
No, it would
OR date
definitely
or
have to.
yeah.
Exactly. So if it does have an inconsistency, it's going to be a critical error.
Thanks.
Okay. Thank you, Carol, Mel.
Mhm.
Our next question from Marina, is there any way to not receive the immediate customer service survey email when you send off a ticket? It's an auto reply, I guess, but annoying when you haven't even gotten an answer to your question. I don't know. Jean?
I can take that one. That's
Okay.
a little, because we were hearing from sites that they wanted to have feedback that their request was heard. So that's why IQVIA sends out that email.
Okay.
And now, and so I think we still have to send that email out. So sites are aware that their request was received at the IQVIA side. Otherwise, other sites will be reaching out saying, how do I know IQVIA got my question?
Yep. Hi, Carol. And
Yeah.
Leanne, just to add to that, that's also to ensure to let you know, if you look into that email itself, it'll tell you if it was escalated or not. So that's also another reason. It's just letting you know the tier 1 people had closed out their ticket, but it may have been escalated up to tier 2. So that also is just a reference for yourself also.
Thank you.
Yeah, you're welcome.
All right. From Dawn, when can we expect to see our PID list contacts for our center on the IQVIA platform? I know IQVIA and STS are working to get that CRM integration, but I'm not, to be honest, I'm not up to date on when that fully integration will be complete. I don't know if Mel or anyone from IQVIA has an update on that, when we can expect.
That actually is on our list for elaboration for
Okay.
further requirements around that. So we don't have a time frame at this moment in time, but it is on our list for us to review.
Right. So Dawn, if you do need, or anyone out there, if you do need a list of your current contacts of who is currently listed, just email us at stsdb@sts.org and we can get those lists for you. Again, it's stsdb@sts.org for your current list of contacts. So we'll be happy to provide that for you. Can you send out the slide deck? So the slide deck will be posted after within 1 to 2 business, usually it's by the end of the week. Usually marketing is able to turn it around in a couple of days, but it just depends on what they have going on their plate at this time. So once this webinar is over and we get the recording, I send everything over to marketing and it will be posted out on the STS website under the webinars tab. Diane just wanted to know if we could add that information to the FAQ. So yes, Diane, we could, excuse me, add that clarifying information regarding that FAQ to the training manual. So from Kelly, on our 12/15/20 call, okay, we were told that the logic statements were present in the IQVIA platform. So the 22 logic statements that are now available in the IQVIA platform were not available with the previous harvest. If our internal data quality checks did not pick up on one of these errors, will that record be dropped in the harvest we just finalized?
So these were available in the IQVIA platform as errors, not critical errors, right?
That's correct. They
Right.
were available as errors, but what we noticed is that we had sites that were not actually resolving those errors.
Right.
So now we had to make sure that the severity level was increased.
Right. Thank you. So yes, Patricia, yeah. Patricia was just clarifying that she was meaning that they carry over from their index procedure. Marina wanted to clarify, I don't mind surveys. It is the timing of the survey that is the problem. When you get an auto response from IQVIA that your question has been elevated, you then get the survey. This is not an adequate time period to answer the questions. So she was referring to an actual survey, not the notification.
Yeah,
Right?
yeah, Leanne, so let me just clarify that for you.
Okay.
So Marina, that's if the tier 1 team has done that, but if you could send an email to STS Tech Support and just put attention Gene, and if you could forward that actual survey to me, that way I can look further into it for you.
Right. Thank you, Jean.
Yep, you're welcome.
All right. From Kelly, with the implementation of the logic statements, is it necessary to submit data from 1/1/17 to 12/31/2020?
I can take this
Yeah.
one. So if you
Yeah.
cleaned up your errors as instructed, then no, you don't need to
Right.
resubmit the data. But some sites were not doing, some sites were just going ahead, uploading their data and not going back and cleaning it up. And they were leaving the errors there, not responding to those. So Kelly, if you cleaned up your errors, then you have already done this part and you're fine.
Right. And then you can go back and look at your older data quality reports to ensure that you did address these and the errors, and as Carol
Yeah, I
said.
just want to clarify, Leanne, I want to clarify because it seems that words get put out there with specifically with some of the congenital groups, and they get escalated incorrectly to surgeon leaders and things like that. When it says with the implementation of the logic statements, first of all, these logic statements were implemented at the start of IQVIA collecting CHSD data. They were implemented at a level of error instead of critical error, because we have instructed sites to go and make sure that all of their errors were corrected before harvest close. Sites in this group, in the congenital group, decided not to follow those instructions and were letting their errors go into analysis, which caused a lot of issues, which causes issues when that happens and the data is not cleaned at the sites as sites were instructed. So we've escalated the already implemented logic statements to a higher severity. So now those records will not be allowed into the analysis.
Great. Thank you, Carol.
And also, this is Melanie. Also, please know that you could use your harvest summary report. As Leanne said, you can look at previous data quality reports, but what you can also do, so that you're looking at a specific surgical time period, you can use the harvest summary report, and that would also show you those related errors if you have any outstanding.
Great, thank you. Okay. Why would critical errors be flagged on the new logic statements by the uploader if the records weren't changed?
So if you have records that you're submitting that has an inconsistency, such as the list that we provided. So one of those examples would be that the mortality date is before the birth date. If you're submitting that, the system will pick up on that inconsistency, and it's going to flag a critical error. So if that's already standing within your software vendor system, any of those inconsistencies, and you export that and resubmit now to IQVIA, it is going to update and show those as critical errors.
Thank you, Melanie.
Mm-hmm.
Okay. All right. Next question from Heidi, does IQVIA STS foresee us receiving the CHSD report for the data we just submitted prior to the next harvest? Our leadership is eagerly anticipating this report. The data is being sent over to DCRI. DCRI will process the data. The data will be sent back over to IQVIA. IQVIA will work to get that data uploaded. So it will be coming. I can't give you an exact.
To clarify, to answer Heidi's question, as we've clarified in the previous webinars,
yes,
STS surgeon leadership heard the data managers 2 calls ago, and they've made a decision that the next harvest will not close until those reports are released.
Great, thank you.
Right, and actually we said 2 weeks after.
That's right, minimum.
Right.
Minimum. Great. Okay, let's see here. Any additional questions? Marina, you're very welcome. Not a problem. Let's see here. Additional questions. I'm not seeing any hands raised. Okay, here's our next question. You have stated that the errors and warnings update immediately. I assume this was true for the harvest summary and missing variable report also. I had an issue with the adult submission where we changed data and resubmitted, but it was showing up on the reports. The site was telling me that they fixed it. When I looked at the link, they were fixed, but it was over an hour before the reports showed the updates. I need a timeline to look.
Okay, I think this is Rebecca.
Yes.
And yeah, so on Friday, we did have reported issues where some of the reporting jobs were not updating in a timely fashion, and those jobs were restarted. And so I believe you should be able to see those changes. I specifically looked at your site on Friday, and I think you did have a couple that were appearing when you had reported, and those had updated and were no longer showing up on the missing variable report. So I'm not sure if you've had a moment to check today, but if you can recheck, and if you're still seeing that issue, please contact our support team and we can go ahead and make sure that it's addressed. But on Friday, I believe that should have been resolved for you.
So what's a reasonable expectation about how quickly things should update?
And that's a great question. And it will depend on on a typical transfer of data. If a site is uploading over 1,000 records, it can take, we've seen, between 5 to 10 minutes, just depending on the load that's being processed. And then, of course, just in general, with all sites potentially doing a load, especially around harvest close. So usual time frame is within minutes when it's a smaller data set that's being uploaded. So, but typically with the larger loads, we've seen 5 to 8 minutes. In the instance that Rebecca was experiencing, unfortunately, it was over an hour. And at that point, it was escalated, and we realized that those jobs were not performing as expected. So that has been resolved.
Thank you.
Thank you, Melanie. And I think Marina was just commenting on the same thing. Tech had told her there was a lag time before the corrections are viewable, and that's exactly what you had just explained. Okay, let's see here. Is there a way to verify the numbers in the DCRI report when they come out? In the past, I would submit a query request to DCRI asking for the information and then would compare it to my data. I would like to do this immediately upon receiving the report prior to the spring harvest deadline. So with the new, one of the great things with the transition over to IQVIA and the dashboard reporting is you'll be able to have the drill down. So you'll be able to drill down and see which patients were included. For example, table 16, you'll be able to drill down and see which patients were included in those numbers. So that's the information that you would have gotten from DCRI in the past in your minor requests. So this capability will be available when the data is posted and uploaded within the dashboard. One of my corrections for Marina took overnight before the correction showed up. And that was not with the new submission of the SOM data. It took well over an hour. Again,
that was due to the known issue that occurred.
Right.
Yeah.
Thank you, Melanie. That still doesn't make sense with what IQVIA has told us how the uploader works. The inconsistent entries would already be in the IQVIA system, not just our vendor software. So IQVIA looks for critical errors before it looks for changed records.
That is correct. At the time of submission, it will look at critical error messages that are included in the submission. It will do a check to see whether or not any of those inconsistencies are hitting a critical error. And so when you hit a critical error, you'll notice that there is a separate window that appears to tell you that critical errors have been encountered and that you have the ability to either cancel the upload or continue the upload, but it will drop those records. There is usually that notification window that will appear before any processing even saves to the database. So that's what it's doing at that point in time, is that it's checking for the critical errors. And if it encounters any critical errors, it will display that window to indicate the specific fields that are basically generating the critical errors. And it allows you to either continue with the upload or cancel the upload.
Great.
Does
Thank you.
that cancel the upload for that record or cancel the whole upload?
The whole upload. It basically indicates to say your submission has encountered critical records, and it basically will stop, allow the user to stop at that point, make those corrections, and then go ahead and resubmit the corrected file. But if they don't want to stop in that moment, they have the ability to proceed with the upload, but it's going to drop those specific records that it encountered the critical errors on.
Does that help, Dr. Meyer?
Yeah, I was I was just trying to imagine how this would work for somebody, trying to upload, it's like ours, we're uploading, 12 or 1,500 records. And so, anyway, I guess I think I understand.
And it does, even if they proceed with the upload and it drops those records, the data quality report does provide the list of those records
Right.
that encountered those critical errors so that they still have something to reference to be able to go back and make those corrections.
Great, thanks. That's what I was gonna get to. So you anticipated my question.
Perfect.
But a great question. Thanks.
Thanks, Dr. Meyer. All right. Okay. So from Vera, when I'm aware of upcoming harvest, I have planned vacation around harvest times. Yes, that. When we don't know when to anticipate harvest deadlines, I hope that you can consider a minimum of 30 days and not 14 in order to accommodate vacation time off, et cetera. Absolutely. Yeah, Vera, yes, we understand that, obviously data managers plan vacations, et cetera, around harvest close time. So obviously we will work with you all to give ample time for harvest close. Typically, I think from what I can absolutely remember, we've given at least 30 days notice prior to harvest close dates, and we know how challenging the harvests have been lately. So we just say a minimum of 2 weeks, because at a very minimum, we would give you 2 weeks. But obviously, STS would give you as much as good a lead time as possible as we can give. So we do take that into consideration into our closing deadlines. Let's see, from Diane. Thanks, Leanne. Would it be possible to post the process of verifying the DCRI reported data in the dashboard, maybe in the library? That's a good question. I don't think we can take that back and discuss that amongst the STS and IQVIA teams. So yeah, Diane, we can take that back and discuss that on our elaboration calls. Let's see here. Sam, okay, Sam says, thanks, you're welcome. Amy, in regards to Heidi's question, the CHSD report for the data that was just harvested, would it be possible for the STS to send out a formal communication regarding the anticipated timeline? As I understand it, the data is currently with IQVIA or en route to DCRI. DCRI then needs 6 to 8 weeks for analysis. IQVIA then needs to build the user environment to display the reports. I would like to communicate this information with my surgeons and leadership. So, yes, we can work on it. Yep.
Yeah, we can definitely take that back and discuss it between our teams, Leanne.
Yep, absolutely. I was just going to say the same thing.
Yeah.
Oh, perfect. Okay, let's see here. I am not seeing any additional questions, no hands raised. I don't know if anyone has anything they wanted to add while we are on hold to see if any other questions come in. Anyone from STS or IQVIA or group surgeon leaders? Let's see here.
Hi, this is Janet Kreutzer. I talked to a data manager who was on the Eddie call that I wasn't on, and there seemed to be some confusion about TET pulmonary atresia and pulmonary atresia VSD. Are we allowed to discuss clarifying some of that for the next couple of minutes if there's no other questions?
Carol, Dr. Meyer, Dr. Jacobs?
I'm here, so if whatever you want to do is okay with me. I don't cut into anybody else, but anybody else.
Yeah, it'd be helpful if we can
more.
clear up some confusion. I think it's great. Sure.
Absolutely.
I'll try to help, John.
Yeah. Thanks.
Jeff, I don't have the full story. I just know that there was some confusion about coding patients that are TETs with pulmonary atresia, because we know that that shortlists to pulmonary atresia VSD, and then how it fits in. So I thought it might be just important to mention that pulmonary atresia VSD is a term that's utilized in STS, but if you use a long list term, the patient can go in as tetralogy pulmonary atresia. But
the short list term, is pulmonary atresia VSD, which is what it would be.
Right. So if you want your records to match well between your local data and your STS/IQVIA/DCRI data, you probably want to not ever use the term TET pulmonary atresia. You want to always use the term pulmonary atresia VSD as your diagnoses. And then when you're coding the procedure, there are a set of procedures that all start with pulmonary atresia VSD. And then you would try to pull your procedure from the pulmonary VSD procedures. And therefore your diagnoses would match what's done to the patient. These patients tend to be much more complicated than your tetralogy patients, which is why they're excluded from both the lesion-specific section and the benchmark section. So generally they are more complicated, have more other chromosomal issues or syndromic issues. So we want to keep the TETs very, vanilla ice cream. We don't want the chocolate swirl in there. So I don't know what else was mentioned. A data manager shared that there was some confusion and I wanted to be part of the solution. So if anybody wants to add anything or make sure I'm clarifying the right question, that would be great.
The only thing I would say is that regardless of which way one codes this in the long list, it's going to end up in the same place in the short list. So it's not like you can use one strategy versus the other strategy to game the system. If you code TET pulmonary atresia, or you called pulmonary atresia VSD, in the short list, they're both going to end up as pulmonary atresia VSD.
Right.
Right, but people are very focused currently on matching their local data to STS so that they can utilize the STS benchmarks and then match their local numbers. So
Yeah.
the more things that
So their
match
local
across, the
the-
easier it is to make that.
Yeah, their local short list term will match up perfectly using either long list coding strategy. So whether they code it as TET pulmonary atresia in the long list or pulmonary atresia VSD in the long list, it will wind up as pulmonary atresia VSD in their short list locally and at STS.
Right. I mean, people just need to understand that there's some, squishiness in the terminology that's used, right?
Exactly.
But I would agree with Dr. Jacobs that, if it ends up with the right numeric STS diagnosis and correct STS numeric procedure code, that's all that we really care about. It's up to them to do the translation into the local parlance. I mean, if it was, you get the same case. If it was here, we would call it in Boston for whatever it's worth, and without trying to add to the mayhem, we call those cases tetralogy pulmonary atresia. That's just the local custom. We know how to get it to be hooked up to the right diagnosis and the right procedure. Just have to recognize that that's the case, that it's gonna be called the same thing, could be called different things in different places.
Yeah, I agree completely. And coding it with TET pulmonary atresia is going to be one way for it to look in the long list, but in the short list, it gets analyzed as pulmonary atresia VSD.
Right.
I mean, in reality, TET pulmonary atresia is one type of pulmonary atresia VSD, the most common type that represents most of them. But you're not going to hurt yourself by coding it either way.
Does that address your question or point, Janet? Does that make it clear?
I don't know. I just heard part of someone was concerned that it was confusing. I don't have a lot of details. I was not able to listen to the recording of the call to get that level of detail. But I just thought that was the gist of it.
Okay.
Yeah, I think Kelly wanted to clarify. Kelly, you're unmuted if you wanted to go ahead and talk.
Hi, this is actually not related to that.
Oh,
So I do have a question about the logic statements. Back in October, I asked specifically about the logic statements, And we were told that IQVIA was looking into them. However, I'm just wondering when they were implemented, because in December, there seemed to be a little confusion. At one point, we were told they were not implemented, and then someone piped up and said that they were actually implemented.
So this is Melanie with IQVIA. So December, they were implemented, and I think I remember this conversation. Those logics were implemented from when we launched, and they were set to errors. So on your data quality report, if you have a time period that you're looking at specifically, you could look at the data quality report to review if any of those errors appeared. If those were corrected, then those would have dropped off on any subsequent submission. So looking at, for example, the data quality report at a specific time frame, it would have captured that snapshot in time. If they've been updated thereafter, you would not see those errors, of course, appear on either the harvest summary or any subsequent. But if there's any particular question of a time period that they should have appeared, Kelly, then let's work together to take a look at that. But those were implemented initially as errors.
So no, I think my question is when, not whether they were implemented as errors or critical errors. I understand that, but when were the logic statements implemented in the IQVIA platform? Was it
When
in
we launched.
July? It was in July?
When
Okay,
we
because
launched.
I asked in October and I was told they were not implemented, that you guys were working on them. So I just wanted to clarify.
Those specific ones were available at the time of launch, and those were
Okay.
in as errors.
Okay. Thank you.
You're welcome.
All right, thank you, Kelly. Thanks, Melanie. Jeez Louise. So Marina, you have TOF, pulmonary stenosis, not TOF, pulmonary atresia in the list. So I think she just wanted to comment there.
Right.
Okay.
Because all the tetralogy pulmonary atresias are in the list as pulmonary atresia VSD.
Right.
Exactly.
Okay. Sam, we had a patient with TOF, PS, and MAPCUS. Should this type of patient be included in the TOF analysis?
Well, I don't think we have a way of avoiding having it be in the TOF analysis because we don't have a pulmonary stenosis VSD MAPCUS category, right? Dr. Jacobs?
Correct.
So.
But it's not going to be it's not going to be in an analysis of TET repairs because it's also going to have a unifocalization of MAPCUS in it. So it would be
well, it also would come. You'd also get at that if I'm imagining the clinical scenario, right? It's also going to have hypoplastic pulmonary arteries as a procedure-specific factor too. So that will get
exactly
it as well.
All right. I've got, it is exactly 2 o'clock Eastern time. So, oh, Sam, the TOF is primary procedure, not unifocalization.
Yeah.
Okay.
Yep, you're right.
Okay. All right. Perfect. Thank you. And Heidi wanted to know if I had the FAQ that Jocelyn submitted. I'm sure I do. It's in a different mailbox. And I'm sure we just had our call last week. So if she submitted it before last week, then we just discussed this. And it will be put in the training manual. So I cannot pull that up at this time. I'm sorry, Heidi, but if she submitted it.
Okay,
Yeah.
Leanne, yeah, if she submitted it within the last 30 days, then you'll be responding to it.
Yep.
You've just had those calls with the core group
Yep.
and surgeons, and you're sending out responses to those questions. So it can take up to 30 days for a response because they're reviewed with the surgeons.
Yep.
And
Thanks,
on scheduled calls.
Right. Yep. Thanks, Heidi. Yeah, she just thought it might help clarify, but yes, I would have to go pull that information, Heidi. All right. I've got about 1 minute after the hour, so I just wanted to thank everyone for joining today. Thank you for that discussion, Janet. I think that's very helpful to bring that up and for the surgeons to discuss with everyone on the line. So thank you for that information. Thanks everyone for joining today again. If you do have any additional questions or concerns, please reach out to me directly. Again, good, the bad, the ugly, reach out to me. We can discuss it one-on-one. And then I'm happy to take all of your concerns directly to Carol, Donna, surgeon leaders. Again, just here's my information and feel free to reach out. Thank you to my STS colleagues, IQVIA colleagues, Dr. Meyer, Dr. Jacobs, core group members. Thank you all for joining me today, and we will see you all at our next call, which is scheduled for the 23rd. Thank you guys. I hope you all have a great week. Happy Fat Tuesday.
Thank you. Thanks, Leanne.
right.
Thanks, Dr. Meyer, and thanks, Dr. Jacob. Thanks, core
Thank
group
you.
members.
Thanks
All right.
Yeah,
everyone.
thanks. Bye, everybody.
Bye-bye.
Enjoy some king cake.